Similar to fractionated non-ablative lasers, fractionated ablative lasers, such as the CO2 and erbium, ablate only a tiny portion of the skin at each treatment. The skin is first treated with an anesthetic cream, usually left in place for approximately 1 hour. The area is then anesthetized with local blocks and in some cases sedation. Parameters are adjusted to achieve the desired depth and density of the treatment. Here, the active FX luminous is being used. The setting will be 125 milligrams with a density of approximately 4 or 5 and a spot size here of 8 millimeters. Pulses are laid down in an even fashion across the entire treatment area. It's easy to see with the active FX the areas of treatment versus the spared areas. Theory is that these spared areas will allow for much faster and safer reepithelialization. The downtime following a fractionated ablative device procedure is dramatically less than the traditional ablative procedures. Unfortunately, since only a small portion of the skin is treated at each treatment, multiple treatment sessions are required to get the optimal effect. However, even after a single treatment with one of these devices, dramatic tightening and improvement of acne scars can be seen. Here, the treatment area is being first treated with the active FX, which is a little more superficial than the deep FX. Non-overlapping pulses are laid down over the entire treatment area. A smoke evacuator is used in the area to clear the plume. In addition, cold air may be blown across the surface area to increase the comfort of the procedure. After an initial pass, a second pass may be laid over the same area to increase the density or coverage of the treatment. Here, a second pass is being done over the left cheek area. With this patient, the decision was made to treat the deeper scars in the central portion of the cheek with the Deep FX handpiece. The Deep FX has a much smaller spot size than the Active FX and allows for deeper penetration. Here, the handpieces are being swapped out and the Active FX is being converted over to the Deep FX. The Deep FX still uses the carbon dioxide wavelength, but with the smaller spot size allows for more concentrated treatment and deeper penetration into the tissue. This allows better, more effective treatment for the deeper scars. The handpiece is tested out on a tongue depressor to make sure the depth of penetration and the density is proper. Here you can see the smaller spot size and the deeper penetration into the tongue depressor than the Active FX on the right. When treating with the Deep FX, again, non-overlapping pulses are applied to the treatment area. Since the Deep FX penetrates much more deeply, small vessels may be hit and pinpoint bleeding may occur during the treatment. Here, only the central portion of the cheek where the deepest scars are being treated with the Deep FX.